Good morning and welcome back. Well, diseases like polio and diphtheria have become rare in the United States, largely thanks to vaccinations. But some now ask if it is still worthwhile to keep vaccinating kids. Joining us this morning to talk a little bit about this is Gunderson Health System pediatrician Dr. Stephen Randall. Dr. Randall, thanks for waking up with us this morning.
Oh, my pleasure. Thanks for having me.
So vaccinations, we're talking, and I'll start with the question I just posed there. Some people asking, is it still worthwhile to keep vaccinating kids?
Oh, absolutely. I think that, vaccinations are a very important thing. July is Immunization Awareness Month, and so we're trying to make a big push right now to get parents aware about the needed vaccinations for all age groups of children that are a very important part of their overall health.
Why do you think it's become somewhat of a controversial topic?
Well, I think that in today's day and age, there's a lot of information out there, and it's not always easy to tell which information is good information and which information is less reliable. I think a lot of things go back to some concerns with the MMR, measles, mumps, rubella vaccine, with some research linking that to autism. The initial study, which has been completely debunked and retracted, but a lot of that information persists, and I think for parents it can be really hard to know just what to believe at times.
But it is about protecting children, and not only just about that, and protecting the overall community as a whole, isn't it?
Absolutely. Many of the vaccine-preventable diseases are ones that we haven't seen in quite a while because vaccines have been so effective. But many of them are making an appearance here in the state of Wisconsin. We've seen measles, we've seen mumps this year. And these are things that, in the past we really haven't seen much of because of vaccines being so effective.
So vaccine schedules we'll talk about a little bit here. There's a lot of different things to look for parents. What should they, be aware of when setting up a vaccine schedule?
So the CDC and the American Academy of Pediatrics and all the major medical societies have an established vaccine schedule that is recommended. And one of the things that we're also making a push for now is to remind parents it's not just about the little kids that need vaccinations, but teenagers also need vaccinations. And here in the region, the vaccination numbers are not quite where we'd want on all of the immunizations for teenagers. And so we are making a push right now as well to get teenagers in for their vaccinations.
So it sounds like July might be a good time to check and make sure you're up to date on all those vaccines, with it being Vaccination Awareness Month. Dr. Randall, thanks so much for joining us.
Absolutely. Encourage people to get in and see their pediatrician or their family doctor and make sure they're up to date, and check in on all the other routine health maintenance items as well.
All right, good time to keep up on your health as always. All right, Dr. Randall, thank you for joining us this